Today, the topic of discussion you can see in the screen, that is how to become SRF or JRF. So before entering in detail, let's see what is SRF and JRF. SRF is none other than Senior Research Fellow and JRF is none other than Junior Research Fellow. And these two jobs are provided by CCRH, that is Central Council of Research in Homeopathy, on timely or contract basis. And this question, how to become SRF or JRF, this question had been frequently asked by a lot of UG scholars and PG scholars to our team, and the main topic of discussion was regarding the qualification and pattern of exam, and for interview what could be the preparation level and these things. So here in this video we will be mainly dealing with all those questions. So let's get started. So here we will be dealing with two different types of question: when or where we can expect notification. So when is regarding the timeline. So still now there is no particular timeline that the notice will be given on that particular month, so that we can go and check. ऐसा कुछ नहीं है. And now second question, it's regarding where. This answer is, we can get the notifications of SRF and JRF from the CCRH website under the recruitment column. So once we are checking frequently, we will get to know the notification, and based upon the requirement it will be called, and there is no timeline at all for this. So let us move on to the next question. So next, regarding Junior Research Fellow, let's see the qualifications. So first, eligible qualification, that is degree in homeopathy from a recognized university or institute, that is mandatory, we cannot skip over it. Then either enrollment in CCH, which is now called as NCH, that is National Commission of Homeopathy, or State Board of Homeopathy. Any, like if you belong to any particular state, for example I belong to Tamil Nadu and I have my state registration, that is more than enough to apply JRF anywhere. Then the age limit is not exceeding 35 years, and the remuneration or salary would be 31,000 along with HRA, that is house rent allowances, and those house rent allowances depends on where we are getting the job, whether it is in metropolitan city or some other area. Then now we are moving forward with the next question, that is Senior Research Fellow, what are the qualifications? Eligible qualification, PG degree should be there, and that should be recognized by some university or institute. Then enrollment on the central register, it's not CCH, it is NCH now, and or we may have registration in any state board of homeopathy. And here there is an exception. Here, if there is any BHMS degree recognized in the any other institute, along with the enrollment in the NCH or any state board of homeopathy, along with 3 years of experience, and this will be considered for SRF, and this you should know. Next, and there is one desirable qualification for SRF, that is Ayush net qualified candidates will be given preferences. Age limit is not exceeding 35 years, and regarding the remuneration it is 35,000 along with HRA. As I had mentioned before, HRA depends on the location, metropolitan city or mid cities, and based on that HRA will be calculated. That is having different calculation, and we are not going to discuss it in detail. Now regarding CCRH, that is Central Council of Research in Homeopathy, and this council is conducting various types of researches from basic to clinical researches. All things had been conducted here, and most of you might be knowing all the details, and if you have any doubt regarding the researches, you can check in the website of CCRH. And this CCRH is having various units all over India, as you can see in this map, and there were 33 centers or units, I can say. Let us see what are all those. First, headquarter is in New Delhi, and CRI, that is Clinical Research Institute, had been converted into National Institute at Kottayam for mental health. Then other two CRIs is in Noida and Jaipur. Similarly, there are a lot of CRU, that is Clinical Research Unit, in Gangtok, Port Blair, Dimapur, Chennai, Aswal, Siliguri, Hyderabad, Ranchi, Puducherry and Tirupati. And there were few extensions of drug standardization units that were in Gorakhpur and Bhubaneswar. And HDRI, that is Homeopathic Drug Research Institute, that is in Lucknow, and RRI, those were regional research institutes in Guwahati, Gudivada, Imphal, Mumbai, Puri, Shimla, Kolkata and Agartala. You can expect notification from any of the institute. Then comes Clinical Verification Unit in Patna or Bihar, the Drug Standardization Unit Hyderabad, and Center of Medicinal Plant Research in Homeopathy, Ooty, Tamil Nadu. And adding to that, few homeopathic treatment centers are also there. One in Safdarjung Hospital, New Delhi, Delhi Cantonment, then Lady Hardinge Medical College and Hospital, then Ayush Wellness Clinic in Rashtrapati Bhavan, New Delhi, Delhi State Cancer Institute and Integrated Ayush Clinic. So all these 6 centers are in Delhi. So these are all regarding the various units of CCRH. Next. Now we are going to deal with the mode of recruitment. There are 2 different modes. Either there will be written test followed by interview, or there will be direct interview, and this will be purely decided by the officers in charge of the unit or clinical research center, whatever it is. And next. So in this video, we are particularly going to deal with the interview part of SRF and JRF, because for written purpose, you may know that if you are preparing for APGT and UPSC, same type of preparation is okay for JRF and SRF. That will help you much. So now in this video, our expectation is regarding the interview, how the interview should be going. So first, a precise introduction is mandatory. Don't go with large amount of information which were unnecessary. So let's see how precisely we can make it. First, where you are from, basic introduction, your name along with your location, then BHMS where you had done, then regarding your MD where you had done and in which subject you had done, and if you have any research publication, you can add. Okay, so this is a form of precise introduction which will help the interviewers to get to your point very easily. So make according to it. So now we are going to deal with the BHMS domain. What are all the areas where we can expect the questions? So this is just a roadmap. So you should know more other than this. This is just an idea. So these are all the questions we may expect. So I will give you a clarity by giving an example. So first, regarding frequently encountered OPD cases. So I can say during my BHMS domain, I was dealing mainly with the skin conditions. So in case of skin condition, you should know at least 10 different types of skin diseases which you usually encounter, so that you can go easily with the interview. Well prepared will help you much better. So if there is any bedside clinical examination, so in skin cases, we have lot of bedside clinical examination, like in case of psoriasis, we have Auspitz sign, and in case of pityriasis, we have Curtin sign. So lot different types of signs are there. And in case of bedside clinical examination, and in case of particularly skin condition, we should examine the scalp, we should examine the palms and soles. So these basic things we should have a clear cut idea. So in case of diagnostic criteria, for example, in case of atopic dermatitis, there is one criteria which was used to diagnose the condition, that is Hannifin and Rajka's criteria. So you should be aware of all those criteria which will help in diagnosing the condition. So next, differential diagnosis. For example, if you are encountering any papillosquamous lesion, you should know at least 5 to 10 papillosquamous lesion which may confuse with your particular condition. For example, in case of if you are having a case of psoriasis, you should know the other papillosquamous conditions such as tinea versicolor or lichen planus. Those things you should be aware of. Okay. And in case of investigations and in case of laboratory findings, we have a lot of biochemical markers, there are hematological indices, and in case of other systemic illness, we will go for imaging investigations. So these things we should be aware of. And if therapeutics were, as for example, as we are dealing with skin condition, we should know the specific remedies also related to skin, so that it will be very helpful. For example, arsiod or hydrocotyl asiatica. So such type of remedies you should be aware of, along with the constitutional remedies, and your own experiences may be asked, may be expected. So here in case of repertorial approach, we can expect questions regarding the rubrics or any particular repertory for skin diseases. So these questions we can expect. And at last we may expect sometimes related aphorisms. So regarding the SORA, manifestations of SORA, primary manifestation in case of skin diseases, and we can expect primary manifestation of psychosis or syphilis in case of skin diseases. Okay, so these type of questions we can expect. So we have to be clear regarding the our area of interest and the answers for this. So next comes BHMS thesis, not mandatorily. So you should have some basic idea regarding your BHMS thesis regarding the disease diagnosis, as I had mentioned already. Then regarding sometimes we may expect questions from drug proving also. So first for that you should have some clear idea regarding the homeopathic pathogenetic trial. Don't worry, it is none other than drug proving only, and these protocols were framed by CCRH. So if you check the CCRH website, you will get to know how these protocols are formed and how drug proving were conducted and how many drugs had been proved by CCRH. All those things you will get some idea. Next, now we are moving towards the MD domain. So here also nothing new, as we had discussed in our BHMS domain, similar type of things. We have to be confident and clear regarding our experience. These all are completely based on the experience. So next. So now we are going to deal with the thesis or dissertation part of MD program. So everyone used to commit this mistake, that is the topic of your thesis should be memorized. Okay, so if anyone is asking, you have to give the answer by the next second itself. That much you have to keep it clear in your mind. Then we can expect question from the study design, that is regarding the blinding techniques. It may be a single blind, double blind or triple blind, and if it is triple blind, you have to mention who were blinded and how the procedures had happened, like all those things. And then regarding the randomization, question may be asked who had done the randomization or how it had been done, these questions. And then regarding the positive and negative controls, so in case of negative control, it is none other than placebo, and in case of positive control, it is an well established treatment. It may be other treatment sources also. Then regarding the outcome measures, like primary outcome what you had used and secondary outcome what you had used, and if you had used primary outcome as a questionnaire, you have to know the domain of questions formed, and you should know whether the questionnaire got pre-validated or not. And if you are using the questionnaire in your local language, you should know whether there is a perfect translation had been made or not, those questions, and the internal validity of the questionnaire had been assessed or not. These details you should know clearly. Even in case of secondary assessment also, if the questionnaire is there, then these things you should know. Then regarding the diagnostic criteria, how you had diagnosed the disease condition which you are examining in your thesis or dissertation, that is more important. And you should know the ICD-10 classification number of your disease. For example, my thesis was on vitiligo. So the ICD, that is International Classification of Disease 10, had numbered vitiligo as L80. So instead of writing the diagnosis as vitiligo in patient prescription, we have to write like this to avoid the patient from getting stigmatized. This is common, this should be used commonly in practice also, and this is seen mostly in thesis part. Then you should be aware of your sample size calculation regarding the effect size, how your sample is affecting it or not. And you should be clear regarding the sampling techniques also. A lot of techniques are there, and how you had done in your thesis. Those questions you should know. Then coming to the statistics part, you should know the p-value, how much it is, and regarding the type 1 and type 2 error, we are not going to discuss in detail. If you have doubt, just comment below. We will think about discussing it in a separate video, because all these things require a separate discussion. And regarding the parametric or non-parametric test which had been used in your thesis or dissertation, you should have a clear idea. And now moving towards the conclusion, and here you should know the advantages of your trial and disadvantages of your trial. So whatever it may be, your result may be positive or negative. That doesn't matter, because in case of research we can expect anything that is not in our hand. So you should have a clear cut idea regarding your disadvantage also, what was wrong with your thesis and what could be done to improve your thesis. This clarity should be there for explanation. So next, at last, the question might be regarding your experience. You can share your ideas regarding the drugs you had used and what was your personal experience. This will be valued more. So these are all the questions we can expect from the thesis or dissertation. Apart from this, you have to be thorough in each and every technique which had been used in your thesis. Then regarding research paper, if any, so most of the PG scholars might be having research paper publications. So what are all the things you should know before coming to an interview? So first, you should have a clarity regarding full paper. There should be no confusion. So in case of your paper, if there is more than 6 authors, there will be et al. And in case if the question had been asked why these many authors are there, you should have the clarity that this author had done this, this author had helped me in literature review, this author had helped in data acquisition. That type of clarity you should have. Okay. Then regarding the journal name where you had published, and that should be in your mind. Then editor-in-chief of that particular journal, like may or may not be asked, but if you know, that will be very good. Then whether your journal got peer reviewed or non-peer reviewed, that you should know. And regarding the indexation and impact factor, these things you should have some clarity if you are having any research publications. So if you have any doubt regarding it, comment below. We will discuss in a separate video as I had mentioned before. So sometimes in your recruitment for SRF or JRF, you might have been recruited for some particular study which they used to mention in the notification itself. For example, I can say previously there was NPCDCS project going on, and that was mentioned in the notification. So in that case, you should have a clarity regarding this national program and what are all the conditions they are dealing with. You should know the goals, you should know the objectives, and these things you should have clarity before entering into the interview. And what are all the diseases they are dealing with, how they are diagnosing, all those things you should know. And how they are measuring the outcomes, as I had told while discussing regarding your thesis. So this clarity should be there. So now I think malnutrition trial is going on. So if you are attending interview for this, you should have some clarity regarding all what are all the malnourished diseases we have for sugar, marasmus. A lot of things are there, and what are all the things contributing for the malnutrition in India. Economic factors also you can think about. So you should have vast idea regarding that particular study, at least regarding the condition which we are going to deal with. So few extra things. So in case of publication, we have guidelines. So here in case of meta-analysis, systematic review, we have PRISMA guidelines. In case of RCT, we have CONSULT, where Red Dot is the extension of CONSULT. And in case of case series, we have CARE guidelines. So regarding the guidelines, you should have some clarity. If you have any doubt regarding the guidelines, you can check equator.com. and you should know what are all the different referencing styles. We have Vancouver, APA, lot of styles are there. You should have some clarity, and you should know what is DOI, that is digital object identifier, which will help us to find the article very easily over the digital media. So these are all the basic things. I had given only few extra questions, so we have lot more to discuss in the research. So before going to the interview of SRF or JRF, these basic things we have to be very clear regarding. Okay. So thank you so much and happy learning with us. If you have any doubt, kindly comment below. We will discuss about it surely. Thank you so much again.